Hi, everyone. Welcome to the LactFact podcast, which highlights recent clinically relevant research, policy statements, and protocols that you, as a practicing lactation professional, would probably like to know about. I'm your host, Dr. Eglash. I'm a board-certified family physician and breastfeeding and lactation medicine specialist at the University of Wisconsin School of Medicine and Public Health. This podcast is written and produced by the nonprofit organization IABLE, which is the Institute for the Advancement of Breastfeeding and Lactation Education. We have no commercial funders for this podcast series. Hi, today I'm going to talk about an article entitled Postpartum and Lactation-Related Genitourinary Symptoms, a Systematic Review, and the first author is Sarah Perlmutter in Obstetrics and Gynecology 2025, issue 146. So the authors of the systematic review point out that in 2024, the term genital urinary syndrome of lactation was introduced in the literature to describe the genital and urinary symptoms related to having an elevated prolactin and low estrogen state. As many of you know, during lactation, elevated prolactin prevents the hypothalamus from secreting a hormone called gonadotropin-releasing hormone, which results in lack of ovarian activity. And because the ovaries are not cycling, the lactating individual has low circulating estrogen and androgens. This essentially means that during lactation, the elevated prolactin level causes a hormonal state that's similar to menopause. Low estrogen and androgen levels can lead to loss of elasticity and thinning of the vaginal tissues, along with vaginal dryness, lack of lubrication, pain with intercourse, pain with urination, and increased risk for bladder infections. The authors state that the symptoms of genital urinary syndrome of lactation are not well recognized and can significantly affect the quality of life. So they did a systematic review of the literature, evaluating articles that referred to postpartum breastfeeding and genital urinary symptoms to evaluate the prevalence and the extent of genital urinary symptoms during lactation. After a review of dozens of research studies, they found that overall breastfeeding individuals had a 24% increased prevalence of reduced sexual satisfaction compared to non-breastfeeding postpartum individuals. The most common symptom was reduced sexual desire related to postpartum lactation, and this improved with return of menses. This decrease in sexual desire was accompanied by a decrease in sexual arousal, particularly in the first 3 to 6 months during lactation. Some research demonstrated that sexual arousal improved after resumption of menses. Interestingly, women who were 30 or younger had fewer problems with sexual arousal compared to women over 30 years of age. They found that about 2/3 of breastfeeding individuals had vaginal dryness, reduced lubrication, and pain with intercourse. They were twice as likely to have these symptoms as compared to postpartum women who did not breastfeed. All of these symptoms, like sexual desire and arousal, vaginal lubrication, etc., were found to gradually improve over time upon return of menses. Breastfeeding was also found to be a significant risk factor for difficulty with orgasm, and this also gradually improved over time. Many of you listening are probably thinking that this all makes sense because nature wants lactating women to focus on making milk and not becoming pregnant again, because pregnancy can reduce milk production and historically would have put a young infant at risk for malnutrition or death. But in addition to hormonal influences, stress and fatigue most likely contribute to a reduction in sexual desire, as well as partner dynamics as they navigate their new shared roles as parents. One other finding in this review is the higher incidence of urinary stress incontinence in breastfeeding versus non-breastfeeding postpartum individuals. This might be a symptom that many birth parents attribute to the changes in their pelvic floor muscles from carrying a baby and giving birth, but it would be helpful for individuals to know that the low estrogen state during lactation also thins the lining of the urethra, creating more difficulty with bladder control and increases the risk of bladder infections. The authors point out that fewer than 50% of postpartum individuals seek advice regarding postpartum sexual and bladder function. So these are topics, along with peripartum mood disorders, that we as breastfeeding medicine and lactation specialists could be addressing with our patients at some point postpartum. Hey everyone, thanks for listening. I encourage you to check out iAble at lacted.org, which is LACTED.org, to learn more about our educational projects, courses, educational handouts, videos, live conferences, and webinars. By becoming a member, you are not only supporting our free projects, but you will also receive a series of benefits which you can learn about at our website. I'll be back with another LactFact in a few weeks.